Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Fundamentals in Gynecology, Embryology. Till 6 weeks of intrauterine life, the conceptus is undifferentiated. After 6 weeks, the conceptus is differentiated into male or female. Sex of the conceptus is determined by sex-related gene, that is SRY gene, which is present in the distal end of short arm of Y chromosome. If Y chromosome is present, then fetus is male sex and gonads are testes. If Y chromosome is absent, then the fetus is female sex and the gonads are ovaries. Turner syndrome. Turner syndrome has 45XO and these are female babies because Y chromosome is absent. In Klinefelter syndrome, 47XXY because Y chromosome is present. Though there are two X chromosomes, it is a male baby. For proper development of ovaries, both X chromosomes should be present. Although both the X chromosomes are not needed for the presence of ovary. For the presence of ovary, one X chromosome is sufficient. But for proper development of ovaries, both the X chromosomes should be present. In Turner syndrome, only one X chromosome is present and ovaries are developed as streak gonads. Natural tendency of a conceptus is to develop into a female.
thank you and thank you for watching.